We're out at Austin CyberKnife. I'm with Dr. Cox, and we're talking about treating brain tumors with CyberKnife technology. I guess, first of all, doctor, what kinds of brain tumors are there?
And basically, there are two broad groups. There's over 120 different types of brain tumors, but they're divided into probably malignant and benign. And because the brain is a real confined area, any kind of growth in there is bad because it just doesn't have room to expand. So whether it's benign or malignant, but we treat a lot of benign conditions, both surgery and radiation, and with CyberKnife. And we also treat what we call arteriovenous malformations. They're abnormal collections of blood vessels that shouldn't be there, and if you don't treat them, people can eventually have a hemorrhage, cerebral hemorrhage. So, but those are the two broad categories. Yeah.
What are the symptoms that someone would experience?
And really can vary a broad spectrum of symptoms, from having a seizure to having a headache to having loss of vision, weakness in an arm or leg, and so it's anything that the brain controls can almost be a symptom. Yeah.
So this is a really scaled down model of the robot, right?
Correct. Yes.
How do you use this to treat somebody with the condition of a brain tumor?
What this allows a maximum degrees of freedom to come in at any angle. A good example is if you had a tumor that was between the eyes, this kind of laser-like treatment can go right between and not damage either one of the eyes. That's a good example. Or if something's near another critical structure like the spinal cord, it can avoid that,
yeah,
which a lot of other radiation types can't. So.
And you're actually in another room controlling this.
Correct.
Right?
Yeah, and it's all controlled through a computer program. Anywhere, most fields are anywhere from around 100 different angles it's coming at.
Yeah.
Yeah.
You talked about the precision. What are some of the other benefits of using this as treatment?
Yeah, and one of the original, this type of treatment had to have kind of a halo that basically screwed into your head. It's called Gamma Knife. Good treatment, but it did require this kind of invasive halo that went on patients. And with this, you don't have to have anything. You wear, hopefully, a pretty comfortable mask. There's nothing that actually binds you too much. So that's one of the big advantages, is not having to have that kind of halo. Yeah. It's also, like I said, in some cases it can take the place of surgery, which is invasive, yeah, much more invasive. Yeah.
I know that y'all are really big on letting people continue with their quality of life as best they can through treatment. I know that's a huge benefit as well.
Correct. It is pretty easy. You can actually, in many conditions, continue your normal life. You don't even have to have sedation or anything. So it is about as easy as you can get. Yeah.
We appreciate your time. Thanks so much for having us.
Thank you.
Austin CyberKnife is located on I-35 near the Dell Seton Medical Center at the University of Texas. Call them at 512-324-8060 or go to austincybernifecom.